Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're talking about another important over-the-counter option for allergy relief. If you or someone you care about struggles with seasonal or year-round allergies and is looking for something fast-acting, steroid-free, and flexible in dosing, this medication may be worth considering. And that is Astepro, the first and only steroid-free antihistamine nasal spray approved by the FDA for over-the-counter use, and one of the choices I commonly recommend for allergy-related nasal symptoms. In earlier episodes, I have covered the major over-the-counter nasal sprays used for environmental allergies, hay fever, and year-round allergic rhinitis, including Flonase, Flonase Sensimist, Rhinocort, Nasonex, and Nasocort. If you're interested in those, feel free to check out the previous videos, link above. While those sprays are all intranasal steroids, Astepro is different. It is an antihistamine that delivers its effect directly into the nose. Since becoming available over the counter in 2022, it has added another valuable alternative for managing allergy symptoms. I have discussed Astepro in previous videos, but the audio quality at that time was not ideal. Based on your feedback and with updated information now available, I decided to revisit this drug with a more comprehensive review. So, stay with me as I walk you through 5 key things to know about this bittersweet nasal spray that's changing how we manage allergies. Its indication, how it works, how to use it correctly, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Astepro and who is for? Astepro is an intranasal antihistamine spray that contains Azelastine. The over-the-counter version is approved by the FDA to temporarily relieve symptoms of hay fever and other upper respiratory allergies, including nasal congestion, runny nose, sneezing, and itchy nose in adults and children 6 years of age and older. The original prescription formulation was first approved in October 2008, followed by a higher strength version approved in August 2009. This formulation later transitioned to over-the-counter status in June 2021, allowing access to the same active ingredient and higher strength without a prescription. Astepro can treat symptoms triggered by seasonal pollen as well as year-round allergens like dust mites or pet dander. For patients whose allergies remain bothersome despite steroid nasal sprays or oral antihistamines, Astepro may be a good option to consider. Second, how does Astepro work? The active ingredient in Astepro, Azelastine, is an antihistamine. It works by blocking histamine, the chemical that causes itching, inflammation, and mucus production during allergic reactions. You may be familiar with oral antihistamines like Benadryl, Claritin, Zyrtec, Xyzal, or Allegra. But Astepro works differently. It is applied directly into the nose where it acts locally and begins relieving symptoms within about 15 to 30 minutes. This is faster than over-the-counter oral antihistamines and steroid nasal sprays. Because of this quick onset, Astepro can be used regularly during allergy season or as needed when symptoms flare. You do not need to use it daily for days or weeks to build up full effectiveness, which makes dosing very flexible. Third, let's talk about how to use Astepro. Astepro is for use in the nose only and should not be sprayed into the eyes or mouth. Each spray delivers 205.5 micrograms of Azelastine. For adults and children 12 years and older, there are two ways to use it. You can do either 2 sprays in each nostril once daily, or 1 to 2 sprays in each nostril twice daily, about 12 hours apart. This flexibility allows you to adjust based on your symptoms and schedule. Do not exceed 4 sprays per nostril in 24 hours. For children ages 6 to 11, the recommended dose is 1 spray in each nostril every 12 hours under adult supervision, with a maximum of 2 sprays per nostril in a 24-hour period. Before first use, prime the spray by pumping 6 sprays or until a fine mist appears. If it has not been used for 3 or more days, reprime with 2 sprays or until a fine mist appears. Detailed step-by-step instructions are provided in the package insert and on the official website. But here are several key points. Before each dose, gently blow the nose to clear the nostrils. Tilt your head downward toward your toes. Place the nozzle tip into one nostril. Close the other nostril with a finger. Hold the bottle upright. Aim the spray toward the back of your nose and press the nozzle once or twice according to dosing directions while sniffing gently. Do not tilt your head back right after use, as this will help to keep the medication from going into the throat and lead to a bitter taste. Also, avoid spraying directly on the nasal septum, the central wall between the two nostrils, which contains many blood vessels and limited nasal tissue. Spraying directly on the septum may increase the risk of nosebleeds without improving symptoms. Fourth, let's review the warnings and precautions. Local nasal adverse events may develop, including irritation, nosebleeds, or rarely nasal ulcers. Ask a doctor before use if you have recent nasal ulcer, nasal surgery, or nasal trauma if that has not healed. Compared to older antihistamines like Benadryl, Astepro is less likely to cause drowsiness. However, some sensitive individuals may still feel sleepy. Use caution when driving or operating machinery, and avoid alcohol or other sedating medications that may increase drowsiness. And finally, let's talk about the side effects and safety. In clinical trials of the over-the-counter formulation, the most commonly reported side effects included bitter taste, nasal discomfort, nosebleeds, headache, and upper respiratory tract infections. Overall, these were reported at low rates and consistent with the known safety profile of intranasal Azelastine. The most noticeable side effect is the bitter taste. Even though the formulation includes sweeteners such as sorbitol and sucralose, many patients still experience it. In clinical practice, some patients find it bothersome enough to stop using it, while others tolerate it well. It really varies from person to person. Although this taste may affect whether someone continues Astepro, it is not harmful and does not raise safety concerns for an over-the-counter product. Nosebleeds were observed more common in patients using Astepro than in those receiving placebo. If you experience frequent or severe nosebleeds, stop using Astepro and consult a doctor. Post-marketing experience for Astepro, as well as other Azelastine nasal sprays in different formulations or strengths, has reported additional adverse events. Despite it is difficult to determine how often these occur, or whether they are directly caused by the medication, these reports highlight the importance of stopping Astepro and discussing with a healthcare provider if new, persistent, or worsening symptoms develop. Overall, Astepro has a strong safety profile when used as directed. And there you have it, 5 key things to know about Astepro. A fast-acting, steroid-free, flexible over-the-counter nasal spray that offers targeted relief for allergy-related nasal symptoms. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experiences in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.